give us some privacy here. Hi, Mrs. Smith. I'm Sydney. How are we doing today? Awesome. So Dr. Murphy tells me that we'd love to have a little bit of a frank conversation about heartworm prevention. How does that sound? Awesome. So let me start off by saying that Snoopy here is adorable. So we're very happy that you're so forthcoming about wanting to be preventive with his health. That's definitely because heartworm disease is just an easier and safer disease to kind of be on the offensive about and prevent it from being contracted than to be on the defensive about and address the condition once it's already occurred. That's because any mammalian body, it's just not going to respond well to things floating around in its vessels that it doesn't recognize. So as a result, we're going to ultimately hurt ourselves in trying to halt its progression. As a result, we begin to risk pulmonary hypertension, venous congestion, embolism, potentially liver failure, in severe cases, right-sided heart failure. So we're just very excited that we're going to be proactive about this. Now, our clinic is going to support a product called TriHeart Plus. It's wonderful because it has the same active ingredients as its competitors, covers some intestinal parasites as well, is proven in a lot of our clients to be receptive to the animal. They really tend to like the treat, I suppose, as well as have a timeline option that can be beneficial to some of our Northeastern clients. Now, like I said, it's offered by hand. A lot of red tape in establishing this stuff with the FDA. Clinical trials during that period of time showed that about 94% of the dogs accepted and ate the treat on first offering. Definitely still want you to look around for rejected pieces because ultimately you're spending your money to make sure that Snoopy gets the whole dose. Now that dose is going to have some room for stuffing around Thanksgiving because the dosage is given in weight intervals. So it should still be effective, give or take, within a range of about 25 pounds, whether he loses or gains some weight, okay? So that's super helpful. Additionally, you do only need to give it monthly. Definitely recommend picking a day of the month, first or last, setting it on your calendar, just so there's a routine in place. Now, the American Heartworm Society is also going to really love these routines because mosquitoes are the vectors for heartworm disease. And they can come up when you least expect them. So they're definitely going to recommend, and our clinic is going to follow that recommendation in administering the preventative year-round. However, you should be aware at your discretion, you have the option to only give the medication 30 days after an initial mosquito exposure and a final mosquito exposure, and theoretically still have an effective dose in the blood to prevent those larvae from growing into their adult stages. Now, the active ingredients are going to be ivermectin and pyrantel. These are going to be effective against heartworms, the 2 most common roundworms, and the 3 most common hookworms. That actual, how it's going to work, ivermectin, it's not known too well. It's related to some cell communication channel that us vertebrates don't have. And pyrantel, know a little bit more about it, super common, is going to basically induce paralysis of the worm, force it to stop doing its thing, and then die, and our body will take care of its body through a traditional normal process. Now, I don't want to scare you. It's safe. There's a lot of testing involved in the approval of these medications. No signs of toxicity were seen at 10 times the therapeutic dose in the sensitized animals. And further than that, the wide margin of safety is still established for pregnant animals, breeding females, breeding males, and kittens and puppies above 6 weeks of age. Now, there are some side effects, rare. In about 1% of the cases, there is vomiting or diarrhea seen within 24 hours of administration. Super common with any sort of GI upset if there were some worms in there, for example. But the actual contraindications where we don't want you to give the drug are going to be in the event of a toxicity. In this case, you're probably going to be seeing something along the lines of drooling, lethargy, potentially vomiting or diarrhea, kind of just not being up to his normal self. And in this incident, we definitely want you to contact us because there's a more primary concern that we need to address. Additionally, part of the reason we want you to come in regularly before giving this is that it is extremely dangerous to give the preventative medicine with adult heartworms present in the vessels. Basically, in the process of them dying, they're going to induce an extreme allergic reaction that is just going to require medical supervision. So for that reason, unfortunately, all heartworm preventatives are going to require a prescription. There aren't any over-the-counter options. You can certainly buy that with us at a client discount. We'd be happy to help you. This PE and negative test is going to be good for a year, so you can call reception at any point in time if you'd like. Chewy.com offers it for between 20 and 40 bucks based on the size of the dog if they need more active ingredient. And TriHeart itself, super easy to maintain, store at room temp. We give it to you in a light controlled bottle with a child-proof cap. I do need to formally tell you, in the event that a human ingests this, we need you to call your primary physician, and they can probably refer you to the poison control hotline as well. But yes, from a large perspective, we want Snoopy to get the preventative medicine. We don't care how. TriHeart, in our experience, has the ability to reliably get the medicine in Snoopy and have the efficacy that it needs, as well as that additional coverage. So what I'm going to do is I'm going to give you this flyer. You can look over it at your leisure, and I'd be happy to help you buy some. Reception can help you out as well, or you can always just, order it at your leisure later. Are there any other questions I can help address for you? All right, it was lovely to meet you, and it was lovely to meet Snoopy. You have a wonderful day. Thank you, Mrs. Smith.